The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead.
Welcome to Project Independence and You.
Good morning and welcome to Community Talk Radio. This is Project Independence and You on LIU Public Radio. I'm your host and producer, Kristina Liu, along with co-host Otto, who is a longtime volunteer, supporter, friend, my all-around buddy, more importantly, right?
Good morning.
And we are on Project Independence and You, and today we are really excited to have on Solange Medina, who is the program coordinator of the Alzheimer's Caregiver Program at Family and Children's Association, and Kristen Haire, who is the Alzheimer's and Dementia Care Counselor. We are going to talk all about this really great program you have, which is Alzheimer's Caregiver Support, and a really important topic. Working in the field, it's something that certainly has been coming up a lot. We're worried about our caregivers and how they're taking care of themselves. So Otto has this look on his face like he's got a burning question. Otto.
No, we've talked on this show often that the caregiver and the family actually probably suffer more than the person who has the disease, because the person who has the disease may not truly really know what's going on, but the family knows what's going on, and the spouse or whoever, children. So the need for support for caregivers, to me, is critical for a lot of reasons, but long list.
Yeah.
So maybe just give us an
the
idea.
basics, right? What is this program?
Yeah.
And what are the services?
So we are funded through Willing Hearts, Helpful Hands, through Parker Jewish Institute. So we are working on a grant. So we have many different programs, starting with support groups, education and training. We have respite programs. Each family can apply for $1,800 towards aid care.
Oh, wow.
Or you could also use it towards a day program if your loved one is interested in going and meeting people similar to them. The aids will also come overnights. Or you can also use it towards a respite stay.
Or a day program.
Yep.
So we
A
do
day
have a lot of clients who use it for day programs. A day program, I hate to say the word, but it's more like it's a daycare for the adults, but it's also stimulation. So we emphasize that, especially if your loved one is in the beginning stages of dementia or Alzheimer's, it's important that you stimulate them. So you can use that 1,800 towards a day, daycare stay. And usually those run between I think $80, $90 a day. So if you think about maybe once or twice a week, you can actually utilize that scholarship for about 2 to 3 months.
So with it, how let's dive into, I'm interested in all the different programs, but with this scholarship program, so how does one apply for that? What is the process for that?
So the process for that, the only exception with this program with the 1,800 is that you can't have Medicaid. So
you can't have Medicaid.
You cannot have Medicaid. This is geared towards the working class, people who are on Medicare. So I know that it sounds weird, but it is. That's the fact of it. It's to help people who are not receiving any Medicaid services.
Yeah, because I think, when you have, because a lot of programs, when you have the Medicaid services, you're able to qualify for certain things. So I think it's this gap of people that don't quite qualify for Medicaid, but, can't afford, these astronomical costs of things. Yeah.
Exactly.
And it's a lot of people.
The cost of memory support, if you will, is astronomical.
Oh, it is.
If you get involved with nursing homes and all of the assisted living type stuff. I happen to, my son-in-law's parents right now are spending $15,000 a month because his mother needs memory care, and they're in a place, and it's not inexpensive.
It's very expensive.
And it won't take long before they're,
Yeah, it's very expensive. Even if you think about caregiving, you're thinking about, I think it was about what we did the last number, $4 billion in unpaid caregiving. So if you're a caregiver, you're actually providing services for your loved one, right? And we don't think about that because It's either your mom, your spouse, a aunt, a cousin, even a friend, right? So all that time that you're spending with them is unpaid time, right? A lot of people, you have to think about people who have to decrease their hours at work or even retire early because they have to care for someone.
Yeah.
That person is losing income in that house because not only are you losing income from the person that is sick, now the person that's caring for them is losing income. So, it's things that they don't qualify for because they are working class. So unfortunately, they don't qualify for Medicaid or,
Right.
any other assistance. So having these grants are very important, right? And people don't know about it. So
if they're
it's good.
if you're interested, someone our listeners is interested in the scholarship thing, what would they need to show to get approval for the scholarship kind of program to get that money?
So basically, there's nothing that anybody needs to show paperwork wise. It's not based on income because it is a grant.
Okay, gotcha.
So basically what they would need to do is contact the program, let them know they're interested. One of the social workers will do an in-home visit because we are sending aides in the home. We also have another respite program, a companionship program where they will come 2 to 6 hours a week. So we do an in-home. We fill out an application, we submit that, and then we also, while we're there, we just make sure the home is safe, that we may send in an aide, a companion, whatever the family chooses, just make sure it's safe. And then, they really just set up the time.
Yeah.
It's a pretty simple process.
Yeah, well, that's so wonderful. I think, we're so used to such complicated, rigmarole, and you got all these papers and you got all this stuff. So to hear, it's like, wait, so so what is the best number though? I definitely want to shout that out throughout the show.
So it's 516-292-1300.
Okay, great.
And they can ask for Regina Anderson.
Perfect.
Who is the program director.
And I believe the extension is 2264.
Yes.
Okay, great.
And what's great is that we don't really ask for much. It's just more of the in-home, making sure the person's needs are met, right? Not only where you can apply for respite, but there's other programs that are very helpful for the caregiver, like our support groups. We do a lot of education workshops and actually teach you how to care for your loved one, right? Because this is not an easy process, right? And sometimes as a caregiver, you don't know how to ask for help, right? Because you don't want to be a burden on anybody, right? So we see that a lot. We see a lot of spouses not wanting to ask their friends, family, even their kids for help, right? And it's like, no, they have their own families. I don't want to bother. But then what happens to them? They get burnt out, right?
Yeah.
So it's important that, you emphasize this on them and say, hey, look, there's help out there and we can help you with that, right? And we notice that in our support groups.
Well, there are various stages you go through, obviously. It starts out okay, and then it gets not so hot. And one of the things I did read is that the program involves gives some sort of consultation to the caregivers at the beginning or throughout the whole process. Is that so? And how deep does that get? Do you, like if people have a very bad experience, like a sundown experience, would you try to consult with them on possible options on how to handle that particular scenario? How deep can you get is what I'm asking. Would you guide them to, okay, now we've had this experience, now what?
So we do guide them. We're actually there for them every step of the way. It's not just setting them up with services. We do provide one-on-one counseling when needed. And we also make sure that they're educated on things. So if something that they want to learn about is sundowning, we will do our research. We will speak to them, let them know, hey, look, these are some methods that you can use. Let's try this out, see if it works. And we're constantly following up with our clients. It's not like we're signing you up for services. Okay, see you later. No, we usually do a follow-up. I want to say like every 2 to 4 weeks. on our clients. So it's something, if something's bothering them or they're in need of any type of services, even that would be considered more of education. We provide that for them.
Yeah, but that's, to me, is worth his weight in gold.
Right,
because,
exactly.
Yeah. You know, you can talk to family, friends, whatever, but they do not have first of all, they can't be that objective because they may be too engaged in the whole thing, to be blunt about it. And they don't have the experience or the training. So to me, the fact that if you're in those shoes as a caregiver at whatever stage you're in, and you know that there are people who know what they're talking about, who you can talk to, how do I handle this? How do I handle that? You know, I've seen it. I mean, it's tough stuff, and it's super beneficial to have people like you that can be talked to. That's my point. And, you know, you can get in, I'm sure you can get into all kinds of different stories, you know.
Yeah, and that's why this also not only the trained professionals, but our support groups, and we also have memory cafes where caregivers can meet other caregivers with their loved ones. That's why those are such important tools as well, because other caregivers might be further along and might be able to help someone that's just coming in with a loved one in the early stages. We do in-person support groups and virtual. So whether you can attend in person or you rather attend on Zoom, but forming those relationship with others is
I think
really
that's one
nice
of,
to see, right?
yeah, and it's one of our biggest things because our members lean on each other as well, right? Because who knows better
Right. That's,
how
I
you're
mean, that's all
feeling
that just kept running
than
through my
like
head when you were
someone
talking.
who's dealing with the same situation. And what I love about those groups is that they lean on each other for support and they give each other advice too. So something that might work for sundowning for them might work for you, right? But they pass on information to each other because not only are they supporting each other, they're also giving each other information, tools that they use to help their lives more, you know, to be at ease, right? So it's good for caregivers to understand that you can go to these support groups. They're confidential. You know, you're talking to someone that's relatable to you. Not only are they empathizing with you, they're going through what you're going through, right? Because we can all empathize with them. We can also, you know, anybody can feel
And
bad
then
for
you
anyone.
walk out the door.
Exactly.
That's the end of it.
But a caregiver to a caregiver knows exactly what you're going through, and they've been through your struggles. And it's so good to see that they build friendships, they build communities. They listen, a lot of our caregivers will have lunch together, form their own little, you know, support for each other. And I think that's important as a caregiver.
Yeah, I mean, I think that's probably like one of the number one things. I was just thinking, you know, it's such an isolating thing being a caregiver, right? Because now here, especially when as we were talking off the air, you know, when you're caring for your spouse or your partner, and you know, a lot of times when you're caring for your parents, you know, all right, like as we were saying, you know, you kind of know that your parents are going to get older and, you know, you're going to need to help out. But, you know, the difficulty of your spouse, you know, your counterpart, you know, you feel so alone. And I'm such a proponent of a support group because I think you don't even realize the benefits of just getting that burden off you. Like, I'm not alone. Oh my God, there's other people going through this, and to have advice, you know, certainly is so helpful.
Me personally, I believe that is more important than the other part of it, where the person who has the disease goes to what you call daycare, which really is basically what it is, because I don't think everybody is suited to do that, to go to a social happening and draw pictures or do whatever. I've had experience with people in that category where they just say, no, I'm not doing it. They went and then they said, no more. You can't make people do what they don't want to do. And that's true of the caregiver too, as far as that part goes. Not everybody wants to share their feelings or their situation, but there's nothing like talking to people who are in the same boat as you're in. To, you know, this is the real deal. We both understand what this is all about.
Yeah.
You know?
Yeah. And I forgot to mention before, we do have various different types. So we do have like spousal support groups. We have an under 40 support group for those. who are younger that are taking care of parents. We have a men's group. We have an adult child support group. So if
Bilingual
you
support
know,
group.
Oh, wow,
yeah, the
yeah.
bilingual. So if you're looking also to kind of hone in on your group, there are also there's general caregiver support groups, but then there also is specific ones that you can look into as
Well,
well.
let's go back to the starting point, all right? First of all, Family and Children's Association has all kinds of stuff.
Yeah.
So let's even start back there. Like if I have a problem of some kind, financial, health, whatever, my feeling is you could probably call 1-800 Family and Children's Services.
Yeah.
Would that be true? Would there be like a number you can call
Absolutely.
where you
Yes.
say, hey, I have these problems. Where can I go? What can I do? It's a little bit like Project Independence.
Mhm.
You know, you call a number, you don't, rather than having to make 400 phone calls yourself and try to find the right
Yes.
place. How would you do that? Like, forget about just the Alzheimer's part of it or
Mhm.
dementia. Let's say we just want to start with, I have a problem.
Yeah. Well, if you're tech savvy, you can go right on to the Family and Children's website and click on seniors. And they have a list of all different services that you can click on. The program director's name will be on there and the number. If you prefer a phone call, what you could do is call the main senior division number, which is 516-292-1300. And you can speak with one of the secretaries and they will direct you to what you're looking for. Like if you're looking for in-home assistance, we do have that with the county. So they could set you up, for example, with case management, home care, Medicaid, food stamps, Meals
Not
on
necessarily
Wheels.
just for dementia or
No,
Alzheimer's.
Well,
we
guys,
have other
we're going to need to take a break
Yeah.
and we will jump right back to this. After the break, we will
Yeah.
continue talking with Solange Medina
Yeah.
and Kristen Haire about the Family and Children's Alzheimer's Caregiver Support Program.
So I get this call from my grandma, and she's like,
"What's a podcast and how much does it cost?"
So I tell her, podcasts are like radio shows, but you can download them on any device and listen to them anywhere at any time, and they're free. And then she says,
"I see, but where can you find good ones?"
And I'm like, go to wcwp.org/podcast and check out the lineup of original shows, or download any podcast app on your phone or tablet and search for LIU Studios. And she's all like,
"Oh, that sounds easy."
And then she asked me what an app is.
LIU Studios podcasts, available on any podcast app. You know, those little button things on your phone screen. Just ask your grandkids.
Welcome back to Project Independence and You on LIU Public Radio. I'm your host, Kristina Liu, and my co-host today is Otto Los. We're going to jump right back in with Solange Medina, who is the program coordinator of the Alzheimer's Caregiver Program at Family and Children's Association, and Kristen Haire, who is the Alzheimer's and Dementia Care Counselor. We are diving into all the things encompassing in the Alzheimer's Caregiver Support Program. And prior to the break, we were talking about, we're lucky with Project Independence. We've been partnered with Family and Children's, and our social workers use you guys as referral all the time. So it's a nice little, sibling relationship, and, because you guys really offer so many things. So I know Otto was curious to know all the services that are provided under Family and Children's.
Sure. And as Kristen was touching base, we do have different types of services for seniors, elder abuse prevention, senior in-home assistance, nursing home advocacy, financial assistance for seniors, health information as far as Medicaid, Medicare, where do you stand, technology and seniors, right? We have something that
Yes, the smart van.
Yes,
we
the
have
smart
it.
van.
We actually have another one coming up this month, I think, actually. It's such a wonderful tool. Yeah.
Isn't it like
It's so cool.
great
It is.
to see,
It's one of my
I
favorites.
just
Yeah.
want to make one
Yeah.
major point, which we do often on this show, is that A, you're not selling anything. This is not like, calling an insurance company about long-term care insurance. And the guidance, for the most part, from what I understand, is at no cost.
No cost.
Okay,
No
so
cost.
to me, that's a major point. People have a hang up about what they think they're getting is charity. Well, it's charity, but it's not really charity. It's guidance in situations that are very tough in life, and you're not selling anything. You're not trying, all you're trying to do is help them get through a tough time,
Yeah.
whatever it may be.
Yeah,
Mhm.
and that's important.
Mhm.
And it's important for people to understand, as a nonprofit organization that's been around for over 140 years, that's what we implement. We want to help out people, and it's not for, not costing them anything, right? It's more of providing services back to the community, right? And it's important. I just wanted to say, it's not like when we go out there and we do it in home and we're like, oh, well, we can't help this person because they're a hoarder, or, they don't have these certain qualifications. We always try to touch base with a service with them. Like, we have individuals sometimes who unfortunately will have hoarding situation, and we can't provide any in-home care for them without solving the issue of hoarding, right? And we have programs that will pay for that within FCA. Also, if someone is in search for any type of meals, Meals on Wheels, we do provide that. We put them in base with one of our case managers in FCA as well too. So it's not that when we go out there, we'll go, okay, this is the only service that we can provide for you because we only work for the Alzheimer's Caregiver program. We try to put them in touch with every service possible that they can get to help them, right?
That's
So
so
step
great.
one is you would consult with a social worker, and if you knew it was about Alzheimer's dementia, that could be in-home or at your office. How's that work?
So we always go to the home because
the
we have
home,
to see
okay.
how the person is
Is living,
living,
right.
See
safety
what the
prevention.
surroundings
Yep.
are. Okay.
Mhm.
You mentioned the word hoarding. That's an interesting one. Uh, I think some older people tend to hoard more than younger people. And I think that goes back to the world when everything was on paper. All your bills were on paper. You didn't know you shouldn't keep your Con Edison bill from 35 years ago because it
You might
really
need
serves
it.
no
You never know.
purpose. Yeah, you never know. But there was this tendency way back to keep paper because that was what it was. So you had 30 years worth of Con Edison electric bills, magazines that you haven't read, and you're going to read them someday, but they're there. And there was a different mentality than now because of technology.
Of course,
And I think that is another topic by itself.
No, and I'm sure that's something that probably comes up often in dealing with an Alzheimer's dementia situation, because they might not be able to, there are certain things, even though my husband quite calls me a hoarder all the time, but that's neither here nor there. I do think like having this, we're always
Just because
you
have a warehouse
of party supplies, that's really, that's a whole nother
with
category.
all your party stuff.
But, I do think, having just this kind of one-stop shop that we always love to say, we love organizations that do that, because I know, especially if you are the caregiver, to have to make 10,000 phone calls of now I got to connect to this person, but the fact that you guys are able to come in and really explain all these services and get people connected makes it so much easier to receive that help, which is just a huge, huge service.
It's hard, especially when you have an individual, let's say you're caring for someone, but you live in a different state, right? And you need some type of care. I can give you a story. I actually had a client caring for his aunt, and he's all the way upstate and she's in Long Island. And she had a really bad fall, and she has Alzheimer's. She doesn't know to go to the emergency room. And guess what? She lives right across the street from an emergency room, right? But we were able to assess that situation, and we actually had a nurse come in and evaluate her and check her out and put her in contact with her PCP and, just provide those kind of services, right? And at least that she's going to be okay, going forward, at least
it's a peace of mind. I mean, it's a true lifeline for people, and that's something, I'm glad you mentioned about living out of state, because I know, through us too, increasingly over the years, we're getting so many calls from, children who live out of state that they're like, mom and dad are here, they need all this care, but like, I'm not there to do these daily kind of things, so having that kind of lifeline like your program is just, a humongous service.
Now, one of the areas you're involved with is you need volunteers, from what I understand, to do some of the respite type stuff, which, like how much respite can you get? Like you talked about the scholarship, but let's talk about just normal, what can I get like as for respite so I can shop or do whatever?
Yeah, so through our program, there are two types of respite programs. So the one is the scholarship program, which we discussed. And then the other one I just mentioned briefly was the companionship program. So the companions, they're not aides, but they are fully vetted. They do have their background check and a medical exam, and they do have training. And a lot of them have taken care of either a parent who had some form of dementia or a spouse, and they want to volunteer. So basically what we do is the supervisor of that program will come in with a volunteer, and they'll get to do a meet and greet with the person because they want them to mesh. And then they exchange numbers, and they could make their own hours with them, and they can come between 2 to 6 hours a week.
2 to 6
2 to 6.
2 to 6 hours a week. And they also provide, if the person likes puzzles, cards, arts and crafts, they can bring a whole bag of that. They can do brain games. They could share meals. They can go on walks. And yeah, I've heard very positive things about the companionship program. And during both of the respite programs, the caregiver can get a chance, whether they want to go to lunch with friends or a very much needed doctor's appointment, they can go out and leave the home for both
or even
of the
sleep.
respite.
Right, exactly, right.
You can go up in your room and sleep.
Yeah.
We have some people go see a movie, get their nails done,
something for themselves,
whatever, grocery shopping.
Can you get the 2 hours or the 6 hours? Like, can you get 6 hours in one day?
You can.
As opposed to 2 hours, 2 hours, 2 hours.
You could split it up, or you could do it in one day, depending.
Yeah, which is nice because, I know, I remember when my grandpa was older, he wasn't dealing with Alzheimer's, but it was hard to get around mobility wise, so having, someone who's able to kind of be with them take such a burden off you, because you're like, oh my gosh, how am I going to do this? Or, so you're able to go for 6 hours, you're able to go to that event or that party that you're invited to, that you probably thought, you might not be able to, which is huge.
It also provides a social stimulation.
Yeah, right.
How do you get the volunteers? You probably don't have like cars lined up in the parking lot, I don't think.
So we get the volunteers through outreach. And we have specific outreach workers who do, they try to set up library events for volunteers. We go to various different churches,
community centers,
events, community centers, temples, churches, just getting the word out there. And as I mentioned before, they do have a specific supervisor for that program as well that goes out and does, presentations for their program as well.
Yeah, I mean, my view is it's probably not easy. You're not always dealing, with the different levels of dementia or Alzheimer's. There's various stages. Some of them are pretty easy, and then it gets not so easy.
Well, they're trained.
Yeah.
They're trained on all the types of dementia.
How long did it get trained, like a volunteer?
20 hours, 20 hours, right? I believe it was 20 hours.
Yeah, it's 20 hours. And like I mentioned before, most of them do have, they volunteer because they have experience already taking care of a loved one
So they're
with
kind
the
of giving back
dementia.
for what they went through.
So, but you don't have to be, you don't have to have that type of background to be a volunteer. They do have student, college age
Okay.
volunteers. But that's one of the reasons why the supervisor for the companionship program does go out to the home with the companion, because she wants to make sure that the caregiver and care recipient is comfortable, as well as the volunteer, and it's something that will work and provide the enrichment like Solange was talking
You know,
about.
you just said something, the caregiver, do you try to establish like who is the caregiver contact? Like, you know, like some families is not quite as cut and dry.
Well,
Uh,
sometimes you have
Yeah.
multiple caregivers, right? Because like I'm going to use your
Mm-hmm.
example. You have a family member who lives out of state, but their mom and dad live together, and the dad has the
Right. Right.
dementia, but the mom is the one caring. But you have the family member reaching out because they know that the mother needs help, right? So there be instance where you have two caregivers, but the one that we would reach out to would be the caregiver that's in the home.
Right.
Yeah, I mean, what I'm thinking is like family dynamics can be different in
Mhm.
many families. And
Yeah.
if you don't have, let's say, one in charge, I could visualize two or three calling up and going in different paths. And I'm thinking that's a good thing to avoid.
Yeah, well, on the application, when we go in, we do establish a primary caregiver. That's actually the
Right.
first.
Yeah, that's like
the
one of the first
first,
things we do.
That's where I'm going
that's
with
one of
this.
the
I
first
think anybody
things.
who might be
Mhm.
listening,
Yeah.
And then
that
we
they have to
have
think about who is going to
Yeah,
be
by the primary.
in charge, if you will.
Yeah. So so one of the first things on the application is establishing that primary caregiver, and then we will take down other multiple caregivers as well, emergency contacts, who we could talk to. But yeah, we do establish one person that we will be called first.
I personally think that's true.
Yeah. Well, you're just trying to avoid as much conflict. And,
Yeah, we're not going to just show up
it's
at
just right.
somebody's
It's just
house and be
right.
like,
It's
hey,
to
your
keep
daughter
it.
signed you up for
to keep
this.
Well, I
it
mean,
No,
seamless.
we don't
family
do those
dynamics,
things. Yeah.
Yeah, it
isn't-
adds a layer,
is
certainly.
like
Right.
varies all over
Right.
the lot,
Yeah.
Uh,
Yeah.
the friendliness, the not friendliness, the who doesn't like who. You're always the one who says, okay, yeah.
I mean, we do get that. I'm not
Mhm.
Yeah,
gonna.
you do. You're living in the
but
real
yeah,
world.
we
Yeah.
do get that. But what we try to do is make it easier for whoever's doing that 24-hour care for that caregiver, right?
Right.
We're not going to go against anybody's wishes. If they don't want the services, it's not a forced service, right? At that point, if they say, no, my kid signed me up for this and I don't want it right now, okay, when you're
Yeah.
ready, let us know. We're here for you, right? But you do still try to to speak to them, let them know the services that they're eligible for. And if they don't need it, and if they don't want it at that time, then, you have to move on. It's not a forceful
Yeah,
thing.
and I think like even so, since you guys have so many layers to the program, if the person is not ready for the service, but the caregiver still needs some education, they're able to tap into that piece, with you, which I think is certainly just so helpful, because I'm a firm believer in the education piece. I mean, that's why I love doing the show, because we're able to get out these, resources that you might not know about, and especially if you're a caregiver, like how should you know what is the right thing to do? Your instinct is emotional, or you're going to get frustrated or not understand or take it personal or something, the behavior. So I think having that education piece is such a huge thing just in itself.
Well, my opinion is the resources like Project Independence, Family and Children's Association are great resources because they cut through the stuff, if you will.
Yeah.
Because otherwise, if you try, we have so many resources in Long Island.
course, yeah.
It's unbelievable.
Yeah.
We really
Yeah.
do. I mean, we're very fortunate. We complain about Long Island for a lot of reasons, but there's also tremendous assets.
Yeah.
Like the
Yeah.
resources,
Yeah.
like within here,
Yeah.
3 major hospitals, 400,000 doctors, whatever kind you need, services like yours. And to get at them can be overwhelming.
Right.
So if you
Right,
can
you just
go
throw in
to
the towel
one
half the time.
place and find guidance, that's worth its weight in gold
Yeah.
again,
You know,
Yeah.
it's also important that you make connections with other organizations, right? It's important that if I know I can't help a client,
Yeah, absolutely.
I know that I can reach
Right.
out to this organization and they can help them, right? Even if it's not from us, at least we can put the person into the right direction. So I like that out here in Long Island, everyone works together.
Yeah.
It's not like a cutthroat
Yeah,
kind
not
of
having
like, oh,
competing-
we're doing the same thing.
Yeah.
So I'm not, no, I know that if I can't provide these services for you, this organization
Yeah, because we
can.
all have our toolboxes,
Yeah.
right? And that's what I always say, and that we know, okay, like
Yeah.
let's refer to this organization. And that's what I was saying. Project independent social workers are constantly, reaching out to you guys, for a more intensive or a case management kind of thing and all the host of services that you guys provide. Because I think that is, it's back to like the grassroots kind of initiative of Long Island, is everybody working together. And I think that is a really, really special thing. But great stuff. But after the break, because I know Otto's going to to dive into something juicy.
Another
After the
break.
break, we will continue talking with Solange Medina, program coordinator of the Alzheimer's Caregiver Program, and Kristen Haire, who is the Alzheimer's and Dementia Care Counselor and we're going to talk about Family and Children's Association Alzheimer's Caregiver Support Program. You're listening to Project Independence and You on LIU Public Radio.
Take WCWP with you wherever you go with the WCWP app. Listen live 24/7 to all of our streams, all from one app. Plus, call the studios directly from the app and visit our social media. Download the app through the iOS App Store on Apple devices or the Google Play Store on Android by searching WCWP Radio, or visit WCWP.org for links. The WCWP app, available now on iOS and Android devices.
Welcome back to Project Independence and You on LIU Public Radio. I'm your host, Kristina Liu, along with my co-host, Otto Los, and we're going to jump right back in with Solange Medina, who is the program coordinator at the Alzheimer's Caregiver Program at Family and Children's Association, and Kristen Haire, who's the Alzheimer's and Dementia Care Counselor. Such great stuff. I encourage everyone, I want to reach out to Family and Children's. The number is 516-292-1300. And of course, there's different extensions for what you're looking for. So for this program, it's 2264. I just think what you guys are doing is so wonderful. And Otto, during the break, you want to bring up your question?
Yeah.
Yeah.
One of the big things about healthcare in general is cost. And the cost of memory care particularly is sky high. And I'm not saying that that's what you support, right? Let's be clear about that. That's not free. But is there, or are there people who people can talk to for guidance about cost? How might I be able to finance certain situations? What my options are? Where might I go? You get to a certain level, and the real world is you can't always stay home. You just get to a point where it's just not good for the caregiver or the person who's suffering from the disease. So, when you get into that category, the cost really starts to, hit the roof. So I'm just wondering where would you guys fit into something like that if you do? Or do you have partners you can guide people to?
Usually, well, I know FCA, we do have financial assistance and financial guidance.
Yes, we have Barry
Yes,
Klitzberg. We've had on our
yes,
radio program
yes.
about
The
Medicare.
Medicare.
He is the go-to at that. And I know that he said that, a lot of times
Yeah.
they could look at certain
They can look at
things.
your
Yeah,
assets, they
right.
can look at your income and kind of guide you in that way. As far as when it comes to caregiving, we do advise clients if they can get their loved one on something called community Medicaid
Yeah.
to kind of step into that, realm. A lot of that does have a little bit of cost to it, like getting an elder lawyer, getting your finances in set, because the community Medicaid does have a 5-year look back. But community Medicaid is geared towards having the person stay at home, right? So having that 24-hour care, an instance, getting a home health aide, making sure that that's paid for at home. Now, when you're talking about a facility, that's a whole different ballgame,
right.
right? We do have clients who've had invested in long-term care, which has helped them out a lot because they're not, they've had to put their loved one in a facility and it'll cover. But you have clients who don't, and they're paying $15,000, $20,000 out of pocket, right? Who has money for that? So a lot of their savings, a lot of all that goes into the care for the person. Unfortunately, we don't have that guidance for the person. As far as, the long-term care, we do advise, but we really don't. We try to
I mean, that is a gray area,
yeah,
frankly.
we
you know,
refer
it's
out,
difficult, you can talk to an accountant, you can talk to a lawyer, you can talk to whoever, but nobody seems to have the whole package. And
Yeah.
I'm not knocking accountants or lawyers, but sometimes when you start talking about some of these things, there is an end goal that's connected to money.
Yeah.
Unfortunately.
like elder lawyers. Yeah.
Yeah.
Well, it's good
Yeah.
to look at websites with like community elder lawyers that work for, they're not overcharging.
Or they might even have like a sliding
Yeah,
scale or
yeah.
something. I know Nassau
Yeah,
Suffolk Law
they
Services,
do.
a lot of time they
Yes.
try to do
We
stuff.
refer
Yeah.
always there, especially to our
Yeah.
clients who
Right.
we know
Which
really.
one was that?
Nassau Suffolk Law Services.
Oh,
So if you, obviously if you're living in the town of North Hempstead and you call 311 to get connected to one of our project independent social workers, and we certainly could connect you right to Family and Children Association for these programs. And also, if you have that, our social workers, as we were saying prior to the break, have, their toolbox,
Mhm.
and we're always trying to fill it with different kind of referrals, because it is expensive, right? It's hard. Unfortunately, when you are dealing with this, a lot of things, you need these intensive paperwork. So then you need a lawyer, it gets complicated
Yeah,
and certainly
yeah.
expensive, but
Yeah.
yeah,
I think it's hard.
You can get into trust, you can.
Yeah.
Yeah, right.
Now they
It's,
got the
Yeah.
new transfer on death
right.
Yes.
thing. And,
Yeah.
you've talked to 22 people and you're going to get 22
Yeah,
opinions
right.
on how to
Mhm.
do it.
Yeah.
And
Yeah.
that's a hard part.
Yeah, it
you know?
certainly is. It's not it's not easy.
Yeah, I know. Also you can, if you're a veteran, you can look into that as
Mhm.
well. They provide a lot of free services for veterans. And like you mentioned before, Nassau and Suffolk Law Service, Nassau Suffolk Hospital
Yes,
Council,
right,
they do
Office
have,
of the
Yeah.
Aging.
if you're looking to apply for Medicaid, for example, they can meet you at a library, and they will apply for you for free. And oftentimes when people hire elder care attorneys to do that for them, it's a couple $1,000. So if you don't have the funds for
Yeah, right.
that, you could contact us and we can refer you to them, or you can call them directly.
Yeah, that's
So that's just an example.
no,
There
that's huge.
are
What
Absolutely.
was
there
the
are-
last one? You said Nassau?
Nassau Suffolk Hospital Council.
Right.
And there are various other agencies that you can apply for example, for Medicaid.
Yeah.
They'll do
Mhm.
it for free for you. You just need to gather the
Mhm.
paperwork and meet with them. And we've had a lot of caregivers have success
Yes.
with those
Yeah, yeah.
programs.
Great.
Yeah, even Office of the Aging, they will connect you to. They do assist with those things as well too. They are based in Nassau and Suffolk, so those are two counties that you can get that assistance from them. But there are ways of doing it. It might be a little bit more like work for
Yeah,
you,
right.
because I know some people are like, oh my God, they have to get all this paperwork in order. That's why they kind of lean towards getting a lawyer.
Right. It's like you
then-
just handle
but
it.
they don't, but they
Right.
don't realize how
Yeah, they
expensive
cost,
it is,
right,
right? So
absolutely.
then it's like, hey, you have to do the leg room to get that, kind of get a little break on that, right? So just know that it's going to be a little bit more difficult, but at least you're not going to be paying like,
Yeah, I mean, truthfully,
of
if you can
dollars on it.
afford it
Yeah.
and you do have a lawyer you can trust,
yeah, yeah.
not, you can trust most lawyers, don't get me wrong. It's worth the money.
It is.
Yeah.
Yeah.
Yeah, but we know, especially as you age, you might not be in the same financial position you were in when you were working or something, so it's hard, things are expensive, and especially when you're dealing with someone, or being a caregiver to someone who has Alzheimer's, they're connected to all these things, and then money, and then it can be so overwhelming. And I think that that's always the major goal of
Yeah.
this is, listen, you might not try and use every single service that's being provided, but there's just to educate you on what is available out there
Yeah,
that you can,
definitely.
use, it's I say just your lifeline, it's just, we're here to educate you. You said a great Solange, you might not want to do it right now, but like, we're here, so when you're ready, reach out. And that's always our kind of motto at
Yeah.
Project Independence as well.
You did mention education. What kinds, like give a couple of examples of what education program somebody might attend?
Yeah, so I did one last week. I did a presentation on unraveling the mysteries of dementia.
Mhm.
That's a very popular one that we do.
We do talking to your doctor,
Yeah.
questions to ask, make sure that you're getting the right information. We do also something for caregivers called CARES. And that is to show you as a family member how to take care of your loved one who has a dementia. So, we talk about topics like how to take away the keys,
Mhm.
if they're driving.
Those are all good topics.
Yeah.
We're actually going to have, I think it's December 4th. In the next hour, I will promote all the programs we have, but we're having one of your colleagues, Gail,
Oh,
is
nice.
going to do a aging in place topic because
nice.
our social worker
Yeah.
was talking about, and that's what they wanted, and we're
Yeah.
actually getting a lot of people to register for that. So that was one of the options,
Yeah.
of chats that you guys do. So
Mhm.
really
You
great.
know,
Yeah.
you just said something that I have on my list, and you said unraveling dementia.
Yeah.
And I had in here uh, guidance on new developments and enabling good chats with your doctor.
Mhm.
I'm also a big proponent of if you're going to go to the doctor, be prepared.
Yeah.
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 and-
Very
and-
Yeah.
important.
And ask some good questions.
Yeah, and as Solange mentioned, we do have talking to your doctor presentation. We have caring for the caregiver, so how to, prevent caregiver burnout. So there are a lot of educational
I think we have like over
programs.
100.
Yeah, I mean, it's
educational
such a great
programs.
list. Yeah, I was
Yeah.
looking
How
at
would
it. Yeah.
somebody find out what the programs are, what the schedule is?
So we
You
do
can
them
go
in
online, but-
various locations. We do hit a lot of libraries because that's where
Mhm.
we, usually will present things.
Mhm.
But if someone is interested in a specific topic, they can always reach out to us and we can always go over those topics with them.
There's no like list of
We do have a list. We do have a list. We do.
internal.
But it's internally,
Yeah,
right?
right,
We send
okay.
those out to like outreach
Mhm.
thing, people in libraries. But if there's something that they have a question about and it has to do with dementia, and we'll try our best to kind of
So if
answer.
there's
And
like
then-
a senior group even that wanted to
Yeah.
have you guys come and do a chat, because in Northampton we have like a lot of these
Oh,
really
yeah.
big groups. So if they could reach out also and schedule one of
Definitely.
these.
Well,
Yeah.
maybe a list of the topics.
Well, I actually have a list of
She
topics.
has a
Okay.
list of the
Yes.
topics.
I have
Well, I
this
have the
lovely flyer that
brochures.
says
Yeah.
free
have-
caregiver
I-
workshop.
yeah,
Well,
I have-
actually, there's a list of all the topics on that.
Yeah,
on
I
that
have
Yeah.
flyer.
And that covers,
All the topics.
Yeah,
that
so
we
Yeah.
have.
you can certainly call 311 if you are interested in this. I'm going to have this available at our advisory meeting
gonna be-
that's coming up in the next couple of weeks too, because it's really such a great list of topics, and it's things, even what popped out at me too. It was how improving sleep can improve dementia symptoms. It's these things that you might necessarily realize are connected, so it's really great. And as I said, through Project Pens, we're going to be doing the tips for successful aging in place one on December 4th at Clinton G. Martin Park too. So
now,
really good stuff.
like in other words, somehow if somebody gets this
Mhm.
list that is on a brochure or a
Mhm.
flyer that they could get by calling
Mm, yep.
you or
Mhm.
Kristina at
Mhm.
311, you could find out where one of these
Yeah.
Yeah.
Yeah, we
programs
have a
are-
calendar. We know where we're gonna be because it's usually one of us that's presenting
Yeah.
the education anyway.
Yeah.
So we pretty much know which ones. Also just keep in mind that not only do we have the workshops, but if someone just has a general question about dementia or where, let's just say, you're having your loved one where they're not sleeping or,
Yeah.
their behaviors are erratic, we can help you with that. We can guide you. We can speak to you. It's
No, and I think that's
nobody's
a
gonna
great,
be-
that's a great chat.
know?
As much as like you see this as a workshop, the fact that you can say like, oh, this is an interesting topic, but you just want the conversation for yourself. You don't have some big group, to have the presentation, I think is really just another great service, certainly. And
Yeah, and they're offered in person. Some are hybrid, so you could either go in person or on Zoom, and then some are only on Zoom. So if you're interested and you want to call our number, we can let you know what's happening in your area. If
Yeah,
it's
great.
not, like Solange said, we can set up a private session.
We've done private sessions before.
yeah, that's all. It's
Um,
really cool. I like that.
Yeah.
Usually
Uh,
within families, like you'll have like sometimes like one family member doesn't understand this, but they want their family member to,
Yes,
so we'll usually
right.
do like a little presentation for
Yeah.
them and kind of give them education. So it's not just geared to these, you know, topics. It's any dementia related topics where we can assist that.
Yeah, that's just, and then another flyer that you guys had sent over, which I loved. I know you said you have these memory cafes, which I love the idea of that too. And this was a morning coffee and tea Alzheimer's and dementia caregiver support program. It's every Friday at 11 a.m. via Zoom, and it's a morning coffee and tea support group, which is just nice. You know, I thought
Right.
that was just a cool thing, because I know obviously in person is nice, but a lot of times when you are a caregiver, having the Zoom option, you just have to go into the other room. You know, you don't have to leave the house. You're able to participate in this, but still kind of get, you know, a little time for yourself.
Some of the, like a call and daycare program, frankly, that's really what they are. You're trying to help the person socialize or whatever, but how about transportation? Is there any transportation?
So
for
you
that?
would have to find out through the agency itself. Like, so if you, I know, Glen Cove is, within the county, so they do provide, transportation. Different day programs provide different types.
Yeah.
They do have it. Sometimes you do have to pay out of pocket. So that's
Yeah,
something
so,
you
and
have
I
to
could speak, you
inquire.
know, for Project Independence, obviously, if, you know, we have our medical transportation, discounted medical transportation program. So if one of these locations is in the town of North Hempstead and you're seeing a social worker, a nurse, or a doctor, you're able to utilize that program to do that. You know, we transport a lot of people to, the Sid Jacobson JCC has a memory program there. We do a lot of transportation there. So your best bet always is to call 311. And, you know, I always say Shari, who's our wonderful mobility manager, if we don't provide it, she will, you know, she has relationships with different companies that, you know, can find the best way for you. And I think, you know, Family and Children's has that similar message.
Yeah.
As you said, Solange, it's not something that, you know, we're very rarely both gonna turn your way and say, sorry, we can't help you, you know,
Yeah.
figure it out. So I think that's great.
Yeah.
Um,
And also just, forgot to mention before with the services, you can start and stop the service
Oh,
as
okay.
well. And you can also start it back up
Yeah,
as
yeah.
so if maybe you're finding it's not fitting your needs at the time, you can stop the service. You don't have to feel pressured into doing like the whole $1,800. You can stop, and you know, if there's a better time for you to start it up again,
that's
you
great.
can.
That's
They'll
really
keep
good.
it on for I think 5 years.
Yeah, and then also
Okay.
we do have like clients who will go away to Florida in the winter, so they'll use it half the
Yeah.
year, and then when they come back, so it's not like something like Kristen said is forced, right?
So is this
Yeah.
something, the 1,800, I'm glad you brought that up because this is a question I had originally. Is it like saying you could apply for every year, or is it just like, you know, you apply that 1 year and then that's, you know, like how it kind of goes?
Yeah, it's every year, up to 5 years.
Oh, so it's every year up to 5 years.
Yes.
Okay. And they're able to use that money at whatever day program they choose. It's not like, you know, you have to use it at this certain one or.
So it's kind of depends on
If
what
it's a
program.
county,
If
no.
it's a county where
Gotcha.
they're not paying,
Okay, gotcha. Okay.
or they're paying
but usually,
a small
yeah,
fee,
small fee, it goes by their income, so
yeah, it
that
would
wouldn't be
count
covered
as
on that.
like there can't be any like double dipping.
Right,
where
right.
Yeah.
No, absolutely. I
counts
mean,
in
because, you
that.
know, the bottom line is you
Mhm.
also want to help the most people possible, you
Right.
know.
But other
absolutely.
than that, they can choose whatever
Yeah.
day program they want. They can.
Yeah.
Yeah.
And even it goes for the home health aid. Like, let's say they have an agency that they have
Right.
in
Okay,
mind
great.
that they liked, they can just give that agency to the person that's calling them about the grant, and they'll pay the agency directly as
That's
well
really
too.
awesome. I mean, it's
all
just so
good
many.
stuff.
It really is. You know, I'm just like looking in front of me at all these different flyers. And if anybody needs information, you could certainly call 516-292-1300, extension 2264. Or obviously you could always call us at 311 or 516-869-6311, and we can get you connected to this wonderful, wonderful program.
Now, and your program, you said earlier, is backed by Parker Jewish
Correct.
and the New York
State,
State Department of Health.
correct. We're
Yeah.
funded from
That's
the
what
It's a
state.
funds this
grant.
whole
Mhm.
thing.
Yep.
Okay.
So the state funds is what funds
Yeah.
this grant. So
Well,
it's
it's
important.
nice of them.
Well, we could certainly talk to you all day long. I would like to thank both Solange Medina and Kristen Haire from the Family Children's Association Alzheimer's Caregiver Support Program for joining us today. Really great information, guys. It's a true
Thank you
service to
for
the
having
community.
me.
Thank you.
And I would like to thank everyone who has listened. You're listening to Project Independence and You on LIU Public Radio.